Здравейте, уважаеми зрители! Днешното издание на предаването МИТ е в необичаен формат. В студиото ни гости ще бъдат изтъкнати специалисти от наскоро провелия се форум на Варненското дружество по детска ендокринология. Екип на нашата телевизия има привилегията да отрази 7-та международна конференция, посветена на диабета, на редките ендокринни болести и синдроми. Затова днес ще ви срещнем с изтъкнати специалисти в полето на детската ендокринология, които участваха там, за да разберем кои са предизвикателствата в тяхната работа. Нека да започнем с професор Виолета Йотова, детски ендокринолог, ръководител на първа педиатрична клиника в Университетска многопрофилна болница Света Марина във Варна и ръководител на катедра педиатрия във Варненския медицински университет. Тя е съпредседател на работната група по обучение на Европейската референтна мрежа по редки ендокринни заболявания.
Ние започнахме през 2011 с първата среща. Беше малко по-трудно, защото основното, което е необходимо, е дългогодишна работа в това поле. След 30 години работа в различни клиники, колаборация с различни колеги, след развитието на специалността в нашата страна, която започна да се развива като официална едва след 1995 година, но винаги е била на почет, тъй като старите професори, учители от миналото време винаги са били сред, те да се каже, отбраната част на педиатричната аудиенция. Така че и е лесно по тази причина и е трудно, защото всеки следващ курс трябва да надвишава като качество и като съдържание предходните. Това е винаги чалендж, винаги предизвикателство, но хората казват, че на моята възраст трябва вече да вземаш предизвикателствата, за да оставаш по-млад.
Чухме изключително възторжени коментари от колегите ви от чужбина относно представянето на младите.
Това е прекрасно. Аз смятам, че правилно са разбрали. Представянето на всички млади колеги беше отлично по много линии. Първо, като изравняване на развитието между отделните структури в България, което е много важно, за да продължи конкуренцията и развитието напред. Второ, като ниво от международна гледна точка, което не отстъпва на европейското в момента. И трето, като умения за презентация, спазване на времето, добър английски език, медицински. Всичко това прави впечатление, защото това ни подрежда на равна нога в Европейската гилдия на детските ендокринолози.
Какъв е топика за България и за Варна?
Имате предвид като заболяване и като посока на развитие. Разбира се, редки болести. Цялата специалност е едно съчетание от редки болести и не всички, разбира се. Всеки има някаква експертиза по-развита в дадена област. Нашите области са редките диабети, нарушенията в половата диференциация, вродения хипопитуитаризъм и някои синдроми като Силвер-Ръсъл, Нунен синдром и, разбира се, също така някои допълнителни заболявания, които започваме да развиваме като краниофарингиом. Това са нашите основни. Ако имате предвид от национална гледна точка, основният топик е как да накараме държавата да препознае експертните центрове, защото тук мисля, че всички чуха, включително и пациентите, които бяха наши гости, че няма как да става грижа навсякъде. Трябва да има концентрирана грижа.
И силна колаборация между центровете.
Да, колаборация, говорене в полза на пациента, а не на собственото его. Тук още имаме какво да постигаме, но смятам, че ще успеем и там. С младите хора ще успеем.
В рамките на Международната конференция на Варненското дружество по детска ендокринология се провежда и следдипломен курс за млади специалисти в областта на ендокринологията и педиатрията.
This is my first time to be involved in VAPAS, and it is my great pleasure and honor to be here. Also in Pomorye, it's a fantastic city, and also it is very to me, it is really fantastic to be with my colleagues and enthusiastic young pediatric endocrinologists here, and we have covered lots of issues on pediatric endocrinology field in a great detail, and yeah, it's fantastic to me. Rare conditions, and rare conditions are not so rare in many countries, especially in countries where the consanguineous marriages are at high rates. So they need attention, they need proper treatment, and to improve their quality of life, we work in collaborations and we put all data together to improve our knowledge and to provide them a better quality of life.
Yesterday we heard lectures from young doctors. What do you think about their lectures?
Yeah, they are really interested in rare conditions, and it is important for young people to increase their awareness on rare conditions.
I'm very impressed actually by the quality of the talks from the Bulgarian young students, residents, PhD students probably too. They speak very well English, they have excellent slides, so particularly in the short presentations that we just had this afternoon, I was very impressed. So and I think it's probably better than about 10 years ago. I think it's about 10 years ago that I was in Pomori for the first time, also invited by Professor Yotova.
Сигурна съм, че за младите лекари и специализанти е изключително важно да почерпят директен опит и да изградят контакти с бележитите учени, които взеха участие в тази конференция. Но нека да се фокусираме върху горещите теми на форума. Едно от най-бързо разпространяващите се ендокринни заболявания е наднорменото тегло. Това е физиологично състояние на натрупване на телесна маса, съставена от мазнини, подкожни и висцерални. Подкожните мазнини засягат най-често крайниците, докато висцералните засягат коремните органи, дроба, сърцето, бъбреците и червата. Те могат да доведат до развитие на сърдечно-съдови заболявания, високо кръвно налягане, диабет тип 2. Тежките форми на наднормено тегло са известни с термина затлъстяване. Към момента 60% от българското население е с наднормено тегло. Какви са последните тенденции в развитието на това състояние, вижте сами.
It's growing everywhere in the world, and the last World Obesity Federation report that just came out in February, it predicts that half of the world population will be overweight or obese by 2030. And they also, there you can see per country the development in it. And it goes up in the Netherlands and it goes up in Bulgaria. And we saw that it's predicted for Bulgaria that around 20 to 30% of the children will be obese by 2030, which is really impressive. So yes, we are having a big pressure on our healthcare system as here, and we are developing strategies to deal with that. What I showed in my presentation was that we really need a more structured approach for it. We need to see that obesity is a disease, and which means that we start with doing diagnostics as we do in any other disease, and then see what this patient needs for care.
Както за мен, така и за вас предполагам, че тези цифри звучат плашещо. Наднорменото тегло има своите обяснения. Индустриализацията, високите количества на калории, заложени в преработените храни, застоялия начин на живот и много други. Но сме стигнали до момент, в който хората с наднормено тегло са повече от гладуващите. У нас, по данни на Националния социологически институт от ноември 2020 година, близо 63% от мъжете над 18 години и 45% от жените над 18 и повече години с наднормено тегло. Отказаното от специалистите, които чухме до тук, оставаме с впечатление, че ендокринните заболявания са в подем. Дали наистина е така? И на какво се дължи бързото им разпространение, особено в детска възраст? Чуйте мнението на специалистите.
It seems that endocrinological diseases increase in childhood. Is it right?
Yes, I think you are right. Thank you for this question. One has to differentiate a bit, you know. For instance, type 1 diabetes is really increasing all over the world. When it comes to more rare diseases, maybe they are also increasing, but maybe they are not really increasing. Maybe it's more that we are able to diagnose them. The technologies play a large role, also for instance, genetics, and also teaching, that a lot of doctors nowadays in many countries are nicely trained, that they recognize the different disorders and they are having diagnosis to put on the children.
Small meetings do something else because they also stimulate interaction. You get to know people, and that is, I think, in research vital, because you want also to have a good work-life balance. So it matters if you know the people you do research with, because I think you're more able then to be open to suggestions and to crazy ideas and then try this. So I think the personal meetings, they are wonderful. It's the first time for me in Bulgaria. So I've met some Bulgarian pediatric endocrinologists I didn't know before. So that is really very good. And we talked about some collaboration and some clinical cases. So I actually personally prefer small meetings. I liked the small, short presentations because they had also the possibility of getting a feedback afterwards. In Denmark, we have an organization where we have some highly specialized centers, depending on the disease, either 1 or 2 or 3. And then the rest is regional hospitals, and we then have a collaboration together. So in Denmark, one of the hot topics, which was not yet touched here, I mean, it covered a lot, that is endocrine disruption. It's the chemicals that can interfere with your hormonal system, and as endocrinologists we see some cases we can't explain with standard endocrine care. And we are a country where, for example, infertility is getting a huge problem. So we are looking into factors that affect girls and boys prenatally, postnatally, because we don't have a good explanation for that. People always say it's because you get older, but that is not really true, because in the, shift from 1800 to 1900, people also first started getting children in their 30s because of financial restraint. So, and there they still could get 5 children or 7 or 8. Today you can't. So we look also into that actually.
Talking about endocrinological diseases worldwide, do you think, it seems to me, that they increase? Is it true? And why?
That's a very difficult question. I think some may increase, maybe not all of them. But hormones are your homeostat for how is your metabolism. And if we change lifestyle that much, that we change body composition and we change how much exercise do we get, how much do we eat, we know that severe eating disorders change your endocrine system totally. But it may also, in a more subtle way, mean something. You can, for example, see in indigenous people, if they change their lifestyle, they all of a sudden develop some, you could say, first country diseases that still are different because their genetic setup doesn't fit with that lifestyle. So I think we may actually over time have seen more subtle changes in hormones, and with some we are also at loss to know, should we do anything about it? Should we treat it? Or should we just say this is how it goes and leave it alone?
I think there is a better knowledge of what pediatric endocrinology is and what are the disease and the specificity in the children. We also care of disorders that are quite frequent in the population, such as obesity. There was a very, very good talk about management of obesity and how to diagnose it in a child. So this is an example of a disease that is quite frequent. And also what is very important for us pediatric endocrinologists to make the transition until the care in adulthood. And there was an excellent talk about this topic on the pituitary disorder. Today there is another talk by an adult endocrinologist, and I think that this mix of pediatric endocrinologists and adult endocrinologists really ensure that we will have the continuity of care for the patients.
And what are your topics in France? In the domain of endocrinology?
So I'm a pediatric endocrinology. I do whole pediatric endocrinology. It's very important to know how to manage almost all disorders in endocrinology in the children. But my topic of research is about disorders that affect the bone mineralization. So children who have hypocalcemia or hypophosphatemia or who have fractures. So that's really where I have the most expertise.
Редките ендокринни заболявания са предизвикателство за лекарските екипи и изискват квалифицирана мултидисциплинарна грижа. Затова специалистите държат на изграждането на мрежи от експертни центрове, в които пациентите да бъдат проследявани през целия им живот, от детска до зряла възраст. Вероятно много от вас се питат какво означава рядко заболяване и колко често се среща то. След минутка ще чуем специалист от Великобритания, който се занимава с диагностика и лечение на синдрома на Силвър-Ръсел. Това е наследствено заболяване, което се характеризира в изоставане на развитието на плода по време на бременността. Забавеният растеж продължава и след раждането. Развива се характерна несъразмерност между главата и тялото. Отделни симптоми се проявяват с различна тежест при различните случаи, но като цяло интелектуалните способности не са засегнати, а забавянето протича по-скоро в физическото развитие.
How rare or how frequent are the growth diseases?
Well, thank you. This is a really good question. So even though these individual conditions that I was talking about this morning, imprinting conditions, are extremely rare, if you group them all together, the birth prevalence is about 1 in 3,500, so not that rare, but individually they're pretty rare. So for example, Silver-Russell syndrome, that's about 1 in 30,000 people.
And you mentioned during your lecture that there are difficulties and differences between diagnostic of children and adults.
That's right. So we have a very successful way of diagnosing a growth-restricted imprinting condition called Silver-Russell syndrome. And the way that we do that is using a clinical scoring system called the Netchin-Harbison clinical scoring system. And that's a very good way of identifying children with Silver-Russell syndrome. The problem is that people with this condition, the features change with age, they become much less prominent. So if you use that scoring system for adults, it doesn't work very well. So what we end up having to do is we need to think about these conditions much earlier and use molecular testing if that's available.
Синдромът на Търнър е друго рядко заболяване, което изисква добро познаване на спецификата на проявите му, за да бъде диагностицирано. На 7-та конференция на редките ендокринни болести в Поморие интервюирахме професор Клаус Графхолд от експертния център в Копенхаген. Да чуем какво разказа той.
It's been a great pleasure talking to Violetta and being invited here to this course in Bulgaria. It's my first time to Bulgaria, and so that's very nice. I know Violetta from the endocrine work in Europe, the so-called Endo-ERN, and there we meet each other. And all the experts on rare endocrine diseases have met each other there, and it's very fruitful and very good to discuss across the borders in Europe.
Endocrinological diseases in youth increase. Why is that?
Well, I don't think it increases, but I think that we are getting better, at least for conditions like Turner syndrome, to discover the patients. So I think the patients have always been there. I just saw a couple of new scientific publications from Tunisia in Africa and other places, just showing us that they're also starting to diagnose their patients, and just as I just heard from one of my colleagues here in Bulgaria, they also diagnose their patients late. So it's a matter of us as doctors being able to diagnose the patients. And although we may think we're very good at it, I think most data show that we're not so good. We're not at least as good as we would like to be. The rare conditions like I'm studying are probably not increasing in prevalence, but the thing about the diagnostics is probably something that is changing the way we view these conditions. So more patients are being diagnosed, and hopefully that is good for the patient.
Хипопитуитаризмът представлява намалена секреция на хипофизата. Това е рядко заболяване с честота 1 на 100 000. Нинке Бирмас е ендокринолог, която разказа за своята работа в университетската болница на Лайден в Нидерландия, с която си партнира Варненската университетска болница Света Марина.
Interesting that one of the fellows of Varna University asked to visit our hospital with the exchange program that was organized by the reference network. That is Dr. Savi Shishkov, and he was able to come to visit the Dutch center for 6 weeks or 2 months or so. And he was able to see the differences in clinical care and also to work on a project in transition of pediatric cases to adult situation.
Actually, how often are these rare diseases?
Oh, how often we see them? Yeah, because of the reference center setup, for me it's my daily work, but in practice, in the population, they are extremely rare, and that makes it very difficult for patients because usually there is a long delay in diagnosis, and then the development, of course, of a child or a disease in adult age continues, and then there are a lot of issues at the moment that the patient is diagnosed. And that usually is irreversible. So there's a very important need to try to, with good education, etc., to make the diagnosis earlier. We start to become a little bit better in detecting them, and that's more the undiagnosed cases in the past. Sometimes we diagnose too much, so we diagnose incidentaloma that would never be a problem in the life of a patient, but we make them ill by diagnosing them. And probably there are also some environmental factors that make incidence of disease different than they used to be. But that's of course very difficult to do research. That's one of the things that was also mentioned here in the conference, that it's so important that we make registries of rare diseases so we get a better view of epidemiology. I think that we are able to solve clinical questions. So sometimes you have a patient and you think there is something wrong, and you try to do all established tests that are there, and then you can't solve it. And with new genetic opportunities, we were able to get these unsolved disorders a name and an etiology. And that's very important because sometimes that really helps with finding the best treatment. So that's also a very important part that, sometimes maybe you had said to the patient, nothing is wrong, but usually they had a problem and we just could not help them. And with the better genetic testing, sometimes you can't do anything, but sometimes you can design a better treatment.
Както сами чухте от интервютата, взети на конференцията на Варненското дружество по детска ендокринология, всички специалисти се обединяват около необходимостта от централизиран медицински подход в грижата за пациентите с тези редки заболявания. Създаването на регистри е друг фактор за по-доброто разбиране на тези заболявания. И не по-малко важен фактор е добрата мрежа от контакти между различните референтни центрове за обмен на научна информация и потенциал в полза на пациентите с редки заболявания. Уважаеми зрители, за днес това беше всичко от МИТ. Надявам се, информацията, която чухте директно от бележити европейски медици в сферата на ендокринните редки болести, да е била полезна за вас. Останете с програмата на Movie TV.